I'll send it to you when I get it. So it seems to me, if we kind of look at this in a timeline way, right? So we don't have that much in the way of family history, except that we know there's inflammatory stuff, heart disease, autoimmune stuff, alcoholism in one person, but we're lacking a lot of information there. But we can know based on the fact of your father's behavior and your mother with her brother, or her father, I should say, that there's a certain dynamic to relationships that it's very common for me to see. And so it's really predictable that if we got a good family history, we'd see a lot more of the anger and the alcohol, impulsivity, etc. If we went further back, but we don't have that. So anyway, that means you have some kind of vulnerabilities genetically, and also in terms of how you were raised, obviously. And that brings us to the issue of the relational PTSD. And that's a big deal because that basically, A, puts your system under stress, and B, makes you distrust, authority, and potentially any relationship really, but probably more men than women. But so that's very stressful, and it's very stressful for a guy. Look, it'd be stressful from any parent. I guess in a way, if I had to pick, would I rather have that from a mother or father? I'd probably rather you have it from a father, because at least you have the mother who's your primary caregiver, your safe haven. But your father is kind of the guy who represents your ability to go out into the world and start a business and deal with authority and set your boundaries and have a sense of self. But it's hard because that what was wired in at that limbic brain level is like, that's dangerous. Authority is dangerous, and I can't have myself vis-a-vis authority. I'm not allowed. It's too dangerous. The more I squash myself vis-a-vis authority, the better it is for me, the safer it is for me. And who knows, maybe sometimes he'll like me, And so that's when you're 2 or 3 or 1, there's no words for this, right? And then it takes a toll on your self-esteem. Then you go into school and you're hanging out with your friends and the teachers and the guys, and especially as you get into high school, it becomes even more of an issue. So your sense of self, gets squashed. And at the same time, obviously, you're really bright, you're capable, and Snapchat has picked you up, and they think enough of you that they decided to put on golden handcuffs. So you've got a good brain, a good mind, but you're carrying this with you. So now in childhood, you've got this relational problem, number 1. Number 2, you've got, and not unrelated, you've got inflammatory immune system problems as a child. So you got the asthma, you have toxin exposure, but mostly the allergies and the asthma and the antibiotics and all that. So your immune system is already reacting, and having a tough time. That could be because, in part it's because of the trauma with your father, and in part it could be, and we don't know yet, due to genetic vulnerability. So I think there's a possibility of a genetic vulnerability in your hypothalamic pituitary adrenal axis, and that it may have, after some age, it may have been hard for you to mount an appropriate steroid response, which is what's needed to calm an infection. And now you say, I get infections and it's not pretty. And that's probably, my guess is you're not actually making enough corticosteroid, or you have these genetic variants so that there's a failure of transduction of the signal at the nucleus. So that even if you are making enough steroids, your cells are not really getting the signal, because it's NR3C1, FKBP5, CRH receptor 1 and 2, CRH binding protein, all these different variants. So that seems to me like that's kind of part of the picture here. So I think it's operational when you're young, And it could be that you were in a toxic household also, because you moved out and all of a sudden you're not on antibiotics. Maybe it's the psychological relief. Maybe it's being out of a moldy home. I don't know what it is. If your parents are in the same home and you feel like spending an extra $250, you could do a mold test in their home. I'm going to suggest you do a mold test where you're living now, just to be on the safe side, okay? Although you could wait, if you want to wait to see if there's mold in your body. If there's mold in your body, then we'll do the test, but that just slows things down. So it's kind of up to you. Anyway, so you have this, you go out into the world and you have these traumas and this inflammatory response, and you know, you're not really, you're tired, you're sleepy, you're tired, you can't think, you can't get up, can't go to school. And then you have all the normal social pressures of adolescence. And so I guess at some point around there, you start experimenting with drugs as a nice way of dealing with the social anxiety, and you feel good and it's fun, and but it's obviously toxic, and with all the toxins that come along with it. Now, somehow you get through. Somehow you get through. I'm going to say that's proof of God, but not necessarily, but you did get through, and so that's fabulous. But now you're facing your adult life, and in a way you've gotten through because you're really bright and you're a good guy. You know, people probably like you. You know, and but then you're starting to hit. Now you're starting to see what you've been dealing with, what you've been running away from all your life, and the truth is you didn't have any way of really coping with it anyway. But now you have the resources, the brain, and the space to actually deal with yourself and correct the things that have to be corrected. And so what are those things? So I like to look at systems, the functional medicine systems. So the other thing I should throw in there is the traumatic brain injury, which may be playing a role, maybe not. But so the systems we look at first is digestive. So you obviously, this response to food that you're having, this fatigue, severe fatigue, I would say, is very likely immunological response. And so I want to look at your gut pretty carefully. I want to do a parasite test. I want to do a gastrointestinal, stool test, and I want to do a bacterial overgrowth test of your small intestine. And then I also, when you have what I suspect is a leaky gut, oftentimes you have a leaky brain because the blood-brain barrier kind of gets leaky from the same things that, your gut is getting leaky. So I'm going to suggest we test you for both the blood-brain barrier and also test to see if your immune system is making antibodies against any of the certain proteins in your brain. Now, that's not going to change what we do, but it will be, if it's abnormal, it'll be a really good marker for us to know like what we've achieved. I think it's very valuable. Normally, I don't do tests that aren't going to change what I do. But if we see a leaky blood-brain barrier or something like that, we need to, that's an important endpoint. We need to make sure that we get that normalized, right? So I'm going to recommend we do that. So that's your digestive system, which is tied to your immune system, but your immune system is also, it's not just your digestive system, although people say 60 to 80% of the immune system is around the gut, but it's also in your respiratory tract, and you're actually having symptoms in your respiratory tract as well because you're sensitive to environmental allergens and pollutants. So I don't know if you have any air filters in your house, or if you need them, you do. Good, so that's good. You have a reactive airway, you have asthma, and certainly allergies. So anyway, that's your immune system. What I'm gonna do on the immune front, aside from the gut, is check certain markers of immune function. You had your CRP. Your CRP was very good. I'm going to check 4 or 5 others. If we get one that's abnormal, the immune system is very complex. But if we get a marker that's abnormal, we can use that also to track our progress. And of course, look for infections, certain things, certain viruses that I think we should look at, and things like mycoplasma, which we should look at. Mono, I want to look at that. Epstein-Barr virus, look at that. And then in terms of toxins, I want to check for mycotoxins, mold toxins, as well as organotoxins, and see what kind of load you're carrying there. We're going to check your ability to detox using this cryptopyrrole test will be one piece of that. Also, other things we'll do. We'll look at that. And then I want to check you for heavy metals. Normally, in someone your age, I wouldn't. But with the cigarettes and the pot and, the other drugs and everything, I don't know, like, cigarettes, you get cadmium, you get lead. I want to see what the burden is. That will be the last thing I treat. Wouldn't be the first thing I treat, it'd be the last thing I treat, but I want to know if that's a part of the issue, because one of the issues, and this is kind of the next system, is the mitochondria. In a certain sense, you could look at your symptoms and say that a lot of them are related to mitochondria. Because you don't have energy. Forget why you don't have energy. I know it's inflammatory, it's hormonal, etc. But you don't have energy. Your brain is, you can't remember stuff. Your brain is struggling to keep up. It's struggling to keep awake. It's struggling to do things, to get motivated. It's just like there's no energy, no gas, and you're taking a lot of gas. You got all these stimulants that you're taking, and still kind of getting by. So I think the mitochondria are a big issue. And probably from all the inflammation, maybe the antibiotics and toxin load, that the mitochondria have trouble. But the good thing is you're young, you can rehab these things, okay? And then we come next to the hormonal system. Now the hormonal system is kind of like, that's low-hanging fruit to fix, and it'll help you feel better quickly. But it's also occurring as a result of all of the things I've talked about. So it's kind of like that's one of the later dominoes to fall, right? But it's easy to take care of. One thing we could do, but I think we'll wait, is a brain MRI, make sure you don't have that little cyst. But I'm going to check some other hormones. If we see an abnormality, then I'll say, yes, you should have an MRI. But right now, I think, no, I don't think we need to do this. We're going to be rechecking your testosterone and your let me just put this down, give me a second here. Anyway, so we'll see about that. But so the hormones are, though, like I said, low-hanging fruit, but one of the last dominoes to fall. But we can treat those. Then we have the issue of genetics, which we'll look at in more detail, and epigenetics. I oftentimes do methylation panel. But recently I've kind of decided that I'm not going to do methylation panels because it doesn't exactly change what I do. And I don't know, it's a blood test, costs a few $100. The nice thing about it is we can track your change. The methylation actually will tell me, like, we'll track it. It can take 9 months to 18 months to normalize. So that's kind of a nice thing. So that's kind of, in a way, it's a money issue. If you feel like, no, I want the data, I'm happy to do it, because you're the first guy that I'm going to say I'm not going to do it on. So how do you feel about it?
I mean, I'm happy to do it. I want the data.
Okay.
I love data.
Okay. I love data too. So methylation is good because we'll be able to track. It actually will give us information about your gut and your glutathione recycling, et cetera. So it's a good thing. I was just trying to save people some money. Let's see, genetics, methylation, and then the last thing would be the structural area, which comes, in this case, we're talking about what I put sleep apnea under there. And of course, sleep apnea, as we talked about, is a real, stress to the body and the brain. So if that's a factor, and it could be really important in terms of normalizing your sleep. But I wouldn't envision it being a long-term treatment because I think we can straighten out the underlying causes of it, And then the last thing is the QEG. So if I can get the NeuroGuide file, if it's eyes open and eyes closed, then I'm happy camper. Because what I really want to do is look at what's going on inside the brain and the connectivity. These reports are nice, but they're like very limited in the information that they're giving me compared with what I normally get. And for example, I'm treating people for depression with laser treatment, right? And it's quite remarkable, and the benefit lasts, So if that, if we get a QEG that suggests that's possible treatment for you, I wouldn't treat it immediately necessarily, because I think of the brain as like a little bit like a plant in a pot, and if I gotta put in good soil and make sure there's good water and good air and get rid of the toxins, and then I'll shine the light on it, and it's going to grow like crazy. That's kind of the way the brain works. So that could be like 6 months out or something like that. It could mean, if you can, it could mean a visit here. Unless we could hook you up with a chiropractor nearby who could maybe do it under my direction. So anyway, that's kind of what I'm thinking. I think that, just to say it again, it's fabulous, fabulous, fabulous that you've gotten to this point. Just fabulous. And hats off to you, pat on the back. I'd give you a big hug if I knew you and I was in person. It's a great job, Alex. But now there's work to do. Now you got to build your life, and you can do it. You can do it, and we have the ability to help you do it. So I think I'm very optimistic.
That's awesome. Thank you. I'm looking forward to working together.
Great. So I'm going to send you now. Any questions, by the way, Alex?
No,